Which of the following is not a common side effects in individuals using selective serotonin reuptake inhibitors, SSRIs? A. Increased risk of bone fracture. B. Low libido. C. Increased risk of suicide in children and adolescents. D. Coronary heart disease. The answer is D. Coronary heart disease. While SSRIs have been known to cause a variety of adverse effects, including diminished libido, increased risk of suicide in children and adolescents, restlessness, photosensitivity, and increased risk of bone fracture, individuals taking SSRIs are not associated with any increased incidence of coronary heart disease. Which of the following over-the-counter medications has been associated with hepatotoxicity and liver failure? A. Cetirizine. B. Diphenhydramine. C. Acetaminophen. D. Acetylsalicylic acid. The answer is C. Acetaminophen. Acetaminophen has surpassed viral hepatitis as the most common cause of acute hepatic failure in the United States. Hepatotoxicity can occur in doses of 7.5 grams or up for adults and 150 milligrams per kg of body weight in children aged 1 to 6. None of the other drugs listed are particularly hepatotoxic. What is the mechanism of cytotoxicity in acetaminophen-related liver failure? A. Depletion of gliadothin. B. Blockage of bile canaliculi. C. Fibrosis of hepatocytes. D. Formation of fatty infiltrates. The answer is D. Depletion of glutathione. Acetaminophen depletes glutathione, one of the body's most important antioxidants. The liver is the body's main processing organ for environmental and ingested toxins, and glutathione is the primary molecule the liver uses to rid itself of the harmful byproducts of the detoxification process. When glutathione is severely depleted, such as with acetaminophen overdose, hepatic cells can rapidly necrose, resulting in liver failure and even death. An individual taking which of the following medications must be instructed to remain upright for a minimum of 30 minutes after ingestion in order to avoid esophagitis? A. Alendronate. B. Finasteride. C. Paclitaxel. D. Phalodipine. The answer is A. Alendronate. Alendronate is a bisphosphonate drug used in the treatment of osteoporosis and osteogenesis imperfecta. An individual taking this medication should be instructed to remain upright for a minimum of 30 minutes after ingestion in order to avoid esophagitis. Other gastrointestinal adverse effects of alendronate include esophageal strictures, achalasia, gastric ulcers, and gastritis. None of the other medications listed are associated with esophagitis. Which of the following is not a side effect associated with beta blockers? A. Dizziness. B. Fatigue. C. Weakness. D. All of these are side effects of beta blockers. The answer is D. All of these are side effects of beta blockers. The most common side effects of beta blockers are fatigue, dizziness, weakness, cold hands or feet, dry mouth, headache, nausea, diarrhea, and shortness of breath. Death by opiate overdose is generally the result of A. Respiratory depression. B. Myocardial infarction. C. Liver failure. D. Serotonin syndrome. The answer is A. Respiratory depression. The answer is A. Respiratory depression. Most opiates can cause respiratory depression when taken in toxic levels. They do this by reducing the sensitivity of respiratory center neurons to carbon dioxide, which results in decreased breathing. In more moderate cases, brain damage can precede death due to CNS hypoxia. Opiates generally are not associated with liver failure, unless taken as a combination drug with acetaminophen, such as hydrocodone, heart attack, or serotonin syndrome. A nurse is working with a 36-year-old patient comes in for a back injury after a motor vehicle accident. He is prescribed acetaminophen for pain relief. 3 days later he calls the nurse to complain that he is experiencing itching all over. He is concerned that he might be having an allergic reaction to the pain medication. There is no rash associated with his pruritus. He has no hives, no nausea or vomiting, no shortness of breath, no swelling of the mouth or face. What is the most likely cause of his itching? A. Opiate-triggered histamine release. B. Dermatitis due to opiate allergy. C. Kidney failure. D. All of these are likely causes. The answer is A. Opiate-triggered histamine release. Many opiates stimulate histamine release by mast cells. The cause of this stimulation remains unclear, but it is considered to be a non-immunological, therefore, not an allergy. There is some speculation that opiates trigger the release of histamine from mast cells by directly activating G proteins on mast cell surfaces. Opiates are not generally associated with kidney failure, and the most common symptoms in opiate allergy include hives, flushing, hives, low blood pressure, gastrointestinal discomfort, though constipation is typical in most patients and does not indicate allergic reaction, and angioedema. Which of the following is a common side effect of nonsteroidal anti-inflammatory, NSAID, Use: A. Weight gain. B. Gastritis. C. Hypertension. D. Muscle spasms. The answer is B. Gastritis. NSAIDs are frequently associated with irritation of the gastric mucosa. This can lead to gastritis, ulcer formation, gastric bleeding, or perforation. NSAID use is not generally associated with weight gain, loss of bone density, muscle spasms, or hypertension. You are assessing a 23-year-old female who presents for follow-up after being started on oral iron sulfate 1 month ago for iron deficiency anemia. In the last month she was also started on azithromycin for a respiratory infection, and has been taking ibuprofen for back pain. She now complains of 3 weeks of constipation. She tells you that her diet consists of many green, leafy vegetables, red meat, and greasy, fatty foods. Which of the following is the most likely cause of her constipation? A. Ibuprofen. B. Green, leafy vegetable consumption. C. Azithromycin. D. Iron sulfate. The answer is D. Iron sulfate. The most likely cause of this patient's constipation is the oral iron sulfate that she is taking. Constipation is a very common side effect of oral iron therapy, and for that reason, iron therapy is often given concurrently with a stool softener to relieve constipation. The other medications taken, azithromycin, and ibuprofen, each commonly cause some degree of gastrointestinal upset, including but not limited to abdominal pain and diarrhea, but not constipation. Dietarily, the consumption of green, leafy vegetables is associated with looser, more regular bowel movements, as opposed to constipation. The consumption of greasy, fatty foods is also associated with looser bowel movements, rather than constipation, making it unlikely that her diet is the cause of her constipation. You are the nurse taking care of a patient with a history of schizophrenia, not on any medications, who is being admitted for disorganized thoughts, paranoid delusions, auditory hallucinations, and combative behavior. The physician orders a dose of haloperidol to be administered. Prior to giving the haloperidol, you suggest that which of the following be done? A. Obtain a CT abdomen. B. Obtain a blood glucose level. C. Obtain a chest X-ray. D. Obtain an electrocardiogram, ECG. E. Contact the authorities to detain the patient since he or she is being combative. The answer is D. Obtain an electrocardiogram, ECG. Haloperidol has the potential to prolong the QT interval on an ECG. QT prolongation can be particularly dangerous in patients who already have a prolonged QT interval due to a pre-existing medical condition, for example long QT syndrome, or medications they are already taking. A prolonged QT interval has the potential to progress on ECG to more dangerous arrhythmias including torsades de pointes and ventricular fibrillation or tachycardia, which can be fatal. Therefore, it is imperative to check a patient's QT interval on an ECG prior to administering haloperidol to confirm that they do not already have a prolonged QT interval. While this patient's blood glucose is not necessarily going to be normal, that is not something that needs to be emergently checked prior to haloperidol administration. There is no indication to obtain a chest X-ray or CT abdomen prior to haloperidol administration. It would be inappropriate to contact the authorities to detain this acutely psychotic patient with schizophrenia, as the patient is already in the hospital and in the care of a psychiatric medical team. Further, even though the patient is combative, if necessary, the medical team is allowed to place the patient in restraints without the need for police intervention. There is no evidence that any members of the care team are in acute danger. A physician orders Viagra, sildenafil, for a patient to treat erectile dysfunction. The patient currently takes fish oil, nitrates for chest pain, prednisone for lupus, and aspirin and simvastatin for vascular disease. Sildenafil is contraindicated in this patient because he takes which medication? A. Aspirin. B. Fish oil. C. Simvastatin. D. Prednisone. E. Nitrates. The answer is E. Nitrates. Sildenafil is contraindicated in a patient who is already taking nitrates because nitrates alone can cause a decrease in the patient's blood pressure, and sildenafil can also independently cause a decrease in the patient's blood pressure. When taken together, sildenafil and nitrates can cause a potentially very serious drop in the patient's blood pressure that can cause headache, dizziness, weakness, syncope, and any further consequences of those symptoms. Thus, whenever sildenafil is being considered for a patient, their current medication list should be closely evaluated for any other medications that may decrease their blood pressure. Neither fish oil, simvastatin, prednisone, nor aspirin are known to decrease blood pressure and therefore would not be contraindications for administering sildenafil to this patient. You are the nurse taking care of a patient who takes multivitamins, pravastatin, verapamil, warfarin, and prednisone daily, as well as sildenafil as needed for erectile dysfunction. He complains of headaches and dizziness when he takes the sildenafil. What is the most likely reason for these complaints? A. The combined action of sildenafil and prednisone. B. The combined action of sildenafil and pravastatin. C. The combined action of verapamil and sildenafil. D. The combined actions of prednisone and warfarin. E. Side effects of warfarin. The answer is C. The combined action of verapamil and sildenafil. In this patient, he complains of headaches and dizziness that are brought on by taking sildenafil, an erectile dysfunction medication. Common side effects of sildenafil include headaches and lightheadedness, as sildenafil can decrease systemic blood pressure since it is a vasodilator. The risk of experiencing these side effects from sildenafil is increased in patients who take other medications that can decrease blood pressure. Of the other medications that this patient takes, verapamil, a calcium channel blocker, is the most likely medication that is known to decrease blood pressure. The combined actions of sildenafil and verapamil, both to decrease blood pressure, best explain the headaches and dizziness that this patient experiences when taking sildenafil in addition to his daily verapamil. None of the other choices are correct, as the only choice that contained two medications that each individually would decrease blood pressure to explain the patient's symptoms was the choice containing verapamil and sildenafil. You are counseling a patient about the possible side effects of his new blood pressure medication, lisinopril, which is an ACE inhibitor. Which of the following statements would be most appropriate to make when counseling the patient? A. Lisinopril frequently causes blindness as a side effect. B. Lisinopril is associated with an elevated risk of renal cell carcinoma. C. Lisinopril is associated with an elevated risk of myocardial infarction. D. Lisinopril is associated with an elevated risk of stroke. E. You may experience a barky cough when taking lisinopril. The answer is E. You may experience a barky cough when taking lisinopril. This question tests your knowledge of the side effect profile of lisinopril. A very common side effect associated with lisinopril use is a barky cough. Lisinopril, an ACE inhibitor, has an additional effect of inhibiting the degradation of bradykinin, therefore raising circulating levels of bradykinin. Elevated levels of bradykinin result in bronchoconstriction, which can cause the dry, barky cough that some patients taking lisinopril experience. Other side effects of lisinopril include but are not limited to hypotension, headache, dizziness, and syncope. Lisinopril is not known to cause an elevated risk of renal cell carcinoma, myocardial infarction, stroke, or blindness. You are the nurse taking care of a patient in a dermatology practice. The patient is prescribed minocycline, a tetracycline antibiotic, for acne vulgaris. When counseling the patient about the side effects of minocycline, you advise the patient which of the following statements? A. Avoid prolonged sun exposure while taking minocycline. B. Severe headaches can be safely ignored while using minocycline. C. Do not drink apple juice while taking minocycline. D. You should not wear sunblock when outdoors while using minocycline. E. You cannot take acetaminophen while using minocycline. The answer is A. Avoid prolonged sun exposure while taking minocycline. This question tests your knowledge of a common side effect of the tetracycline antibiotic, minocycline. Minocycline is known to cause phototoxicity as a side effect in some patients, which may increase the risk and/or severity of sunburn in patients taking the medication. As such, patients should be counseled to avoid prolonged sun exposure when taking minocycline, and if they must be exposed to the sun for significant periods of time, to wear sunblock and keep their skin covered as much as possible. Other side effects of minocycline include upset stomach, diarrhea, tooth discoloration in young children, and rarely, pseudotumor cerebri, severe headache and visual disturbance due to intracranial hypertension. As such, it would be inappropriate to advise a patient to ignore severe headaches while taking minocycline. Apple juice and acetaminophen are not contraindicated in patients taking minocycline. You are taking care of a patient who requires gentamicin, an aminoglycoside antibiotic, for a complicated urinary tract infection. Which of the following would you be most concerned with when assessing the patient during his gentamicin course? A. Visual acuity. B. Liver function tests. C. Hearing and renal function. D. Hot or cold sensitivity. E. Hair loss. The answer is C. Hearing and renal function. This question tests your knowledge of the significant potential side effects of the aminoglycoside antibiotic, gentamicin. Gentamicin, like most aminoglycosides, carries a risk of ototoxicity and nephrotoxicity. As such, it is very important to assess a patient's hearing function regularly while taking gentamicin, and to follow the patient's SPUN or creatinine, to monitor their renal function while taking gentamicin. In addition, gentamicin dosing is often decided upon via close collaboration with the inpatient pharmacist as they take into account the patient's current dosage and the effect that it has had on the patient's renal function to date. Gentamicin is not known to significantly influence liver function, hair loss, visual acuity, or hot or cold sensitivity, and therefore these would not be the most important considerations when assessing a patient who is taking gentamicin. You are the nurse taking care of a patient with intractable back pain. You are about to administer a dose of oxycodone and are describing possible side effects to the patient. Which of the following common side effects should you warn the patient about? A. Constipation. B. Blindness. C. Headache. D. tinnitus. E. Serotonin syndrome. The answer is A. Constipation. Constipation is a very common side effect associated with use of opioid medications, such as oxycodone, especially in patients who have not been frequently treated with opioids in the past. As such, patients are often advised ahead of time about the possibility this side effect and may be started concurrently on stool softeners and colonic motility agents, such as senna and ordocusate. Blindness, tinnitus, ringing in the ears, headache, and serotonin syndrome all are not known to be associated with use of opioid medications, like oxycodone. You are the nurse taking care of a patient with severe hip pain that is unresponsive to acetaminophen and NSAIDs. You are prepare a dose of hydromorphone and describe potential side effects to the patient. Which of the following side effects should you warn the patient about? A. Foot pain. B. Pruritus. C. Diarrhea. D. Pharyngitis. E. Hair loss. The answer is B. Pruritus. Pruritus, or itching, is a fairly common side effect of opioid medication use, and hydromorphone, also known as Dilaudid, is a potent opioid. As such, patients should be advised of this potential side effect prior to initiation of therapy, and should be advised to inform the nursing or medical care team if they experience pruritus, as dosing can be adjusted, and/or additional medications may be added to control the itchiness. Neither hair loss, foot pain, pharyngitis, nor diarrhea are side effects known to be associated with opioid use. The answer is E. Diarrhea. Diarrhea is a common side effect associated with antibiotic use, including cefalexin. This diarrhea is typically self-limited and resolves within the first day or two of administration. Sometimes patients are advised to take a probiotic or consume yogurt when starting a new antibiotic if they experienced diarrhea when starting antibiotics in the past. Neither headaches, hair loss, pharyngitis, nor necrotizing skin rash are known common side effects of cefalexin use. You are the nurse in a primary care clinic taking care of a 26-year-old female with a urinary tract infection. You are counseling her about taking her antibiotic, cefalexin. You warn her that a common side effect is which of the following? A. Pharyngitis. B. Headache. C. Hair loss. D. Necrotizing skin rash. E. Diarrhea. The answer is E. Pregnancy. Patients initiating isotretinoin therapy should all be strictly advised to avoid becoming pregnant, and must absolutely not be started on isotretinoin therapy if they are actively pregnant. Isotretinoin is a potent teratogenic agent, and could cause devastating effects to a developing fetus, including but not limited to termination of the pregnancy. Even one dose of isotretinoin can cause major birth defects of the baby's ears, eyes, face, skull, heart, and brain. Any female patient who is going to start isotretinoin therapy must be tested for pregnancy immediately prior to therapy and repeatedly throughout treatment. Make sure you use 2 specific forms of birth control and have regular pregnancy tests while taking this medication. There is no known significant interaction between isotretinoin and NSAID use. Likewise, there is no reason why a patient on isotretinoin must avoid bananas, grains, or juices. You are the nurse in a dermatology clinic taking care of a 22-year-old female with severe nodular acne. She is going to start isotretinoin therapy after this appointment. She should be strictly advised to avoid which of the following? A. Eating grain products. B. Taking NSAIDs. C. Drinking juices. D. Eating bananas. E. Pregnancy. The answer is D. Edema. All of these are possible side effects of calcium channel blockers, but the most common side effect is edema. Calcium channel blockers decrease blood pressure by hindering the influx of calcium into myocardial cells. They may also increase the diameter of blood vessels, which always results in decreased blood pressure. Which of the following is the most common adverse effect of calcium channel blockers? A. AV block. B. Gynecomastia. C. Nausea. D. Edema. The answer is D. Hypertension. Hydrochlorothiazide is a thiazide diuretic, used primarily in the treatment of hypertension and edema. Which of the following conditions can be treated with hydrochlorothiazide? A. Pericarditis. B. Angina. C. Atherosclerosis. D. Hypertension. The answer is B. Angiotensin receptor blocker, ARB. Losartan is an angiotensin receptor blocker, ARB. This class of drugs lowers blood pressure by blocking the conversion of angiotensin 1 to angiotensin 2 and is useful for patients who cannot tolerate ACE, angiotensin-converting enzyme, inhibitors' adverse effects. What class of drug is losartan? A. Loop diuretic. B. Angiotensin receptor blocker, ARB. C. Angiotensin-converting enzyme inhibitor, a CE inhibitor. D. Calcium channel blocker. The answer is D. Calcium channel blocker. Diltiazem is an example of a calcium channel blocker. This class of drugs reduces blood pressure by relaxing smooth muscles in the walls of arteries, leading to vasodilation and decreased peripheral resistance. Diltiazem is an example of what class of cardiovascular medication? A. Angiotensin receptor blocker. B. Beta blocker. C. Potassium-sparing diuretic. D. Calcium channel blocker. The answer is C. Block response to beta-adrenergic stimulation. Beta blockers act by blocking response to beta-adrenergic stimulation. In that way they are beta-adrenergic antagonists, rather than agonists. ACE, angiotensin-converting enzyme, inhibitors, not beta blockers, block the production of angiotensin II, but both act to decrease blood pressure. Beta blockers have nothing to do with beta cells of the pancreatic islets, which secrete insulin. Which of the following describes the mechanism of action of the class of drugs known as beta blockers? A. Beta-2 adrenergic agonists. B. Block the production of angiotensin II. C. Block response to beta-adrenergic stimulation. D. Block beta cell secretion in the pancreas. The answer is C. Beta blockers cannot be stopped abruptly due to risk of severe, even fatal, rebound hypertension. The most critical safety information a patient must know when initiating beta blocker therapy is that they cannot abruptly stop taking their beta blocker, due to the risk of rebound hypertension. A beta blocker would be more likely to cause bradycardia and a depressed effect than anxiety and tachycardia. Beta blockers are not associated with any type of esophagitis and they are not fat-soluble, thus it is not crucial to eat a fatty meal with the drug in order to improve absorption. When educating a patient on a new beta blocker prescription, which of the following safety information is most critical? A. Beta blockers should be eaten with a meal that contains fat to improve absorption. B. Beta blockers may cause anxiety and tachycardia. C. Beta blockers cannot be stopped abruptly due to risk of severe, even fatal, rebound hypertension. D. The patient must stay upright for at least 30 minutes after taking a beta blocker due to risk of esophagitis.